impact your business, how to. It's basically a how-to, so Benefits 101. So that's where we're going to start with a brief introduction on how they work, eligibility requirements, some basic admin rules, why offering benefits, again, the importance from the employee and the employer perspective, and also the importance of disability. So disability is one of the most important benefits that you can offer as an employer, even as a sole proprietor. So we'll talk about that a little bit, and then we'll talk about some of the tax savings advantages for the sole proprietors. And then some industry trend, which is always a very fascinating area to talk about, and nothing is different in that section this year. Still a lot of big things coming in the industry. So let's just dive right into the Benefits 101. So defining employee benefits. So benefits are any additional compensation paid to an employee on top of their regular salary or wages. Some employee benefits are required by law, and others you can choose to offer. So when we're talking about employee benefits today, we'll be talking about group employee benefit programs. So that typically includes things like life, disability, health, and dental. And then some plans can ensure things like employee assistance programming, critical illness, and then there's all the retirement aspect, so group RSPs and pensions. Other employee benefits that we're not going to touch on can be things like a clothing allowance, that sort of thing. Certainly, employee benefits can be a wide range of things, but for the purpose of this webinar today, we're going to talk about the employee benefits. So pricing a plan. So that's the number one. That's probably one of the bigger questions that I get. I get a lot of emails just saying, how much is it going to cost? Well, there's a process involved to actually pricing benefit plans. So benefit plans are designed to help protect members from catastrophic life events. So the actual big costs that could really jeopardize someone's financial well-being, and then help to pay for some routine medical and dental costs. So in those cases, health and dental is very much more an assistance. It's not designed to be an end-all be-all. A group plan brings value to a large group of people. So that's an important thing to remember as well. The goal of an employee benefit plan is to have something for everybody, but again, not to cover 100% of everybody's needs and wishes in the plan. That would just be too expensive. So we want to bring value to everybody for a variety of things. Plan participation is another really key factor. So you want to ensure that you have all members of your group on your plan. You don't want to just have the unhealthy members that need access to the coverage. You want the healthy people with low claims also paying into the plan and not waiting until they need the plan to join it. So that's a key factor as well. Plan participation for small group plans should be mandatory, and larger groups usually can tend to sit around that 85% participation. So you might not need to be entirely mandatory at that point, but you certainly want to ensure that the majority of your employees are on your benefit plan. So rates are determined by demographics of your group. So that's the usage of your plan. So there's kind of two-prong approach there. So the demographics, that's the actual people that are on your plan. There are some plans that are sort of a canned product offering that have set rates regardless of who you add into the plan. But for the most part, employee benefit plans are priced specifically for groups. So you would need to provide your demographics, so the age, gender, salaries of the employees that you're looking to cover. And then if you already have a plan in place, then it would also take into account the usage of your plan. The best predictor of future claims is past claims. So when you are pricing a plan, it's always a great idea to provide your usage if you have it. There is also the results of a pool. That might be a factor in your rates as well if you do belong to a pool. So some large association plans, for example, all the benefits and all the usage are pooled together, and then your pricing would be based on just the result of that pool and less about your own specific usage. Group plans renew on an annual basis. So that means your rates are going to change every year. And that is done so that every year your provider will take your updated demographics and your updated usage and reset the rates for the following year. And that just ensures that your plan is always priced correctly. that your plan is always accurate in terms of who's being covered, and then you're going to be able to see the usage at that time. You also could get quarterly reporting or semi-annual reporting if you wanted to see your usage throughout the year, but that one annual review really gives you a chance to see exactly how your plan is being used. And then plan design options can change at any time. So when you're pricing the plan, of course, they're going to look at what plan designs you've selected, what levels of coverage you have, and how those are being used. But you don't have to wait until a renewal to make any changes to your plan design or to add or terminate benefit coverages. So it's very flexible throughout the year. So a brief look at eligibility requirements. So who can be on your plan? So benefits are available to employees who are actively at work. That's the biggest piece. You have to have your employees actively at work in order to have coverage. That's sort of the number one policy guideline. Now, if somebody's on a maternity leave, they would qualify to be on your plan because employees on mat leave are considered actively at work for the purpose of benefits. The same holds true if somebody's off on disability or on sick leave. You would definitely want to talk to your advisor and understand exactly how the eligibility takes place there. But for most, anybody actively at work would meet the policy definition. Coverage is typically set as mandatory. We talked about that already in a condition of employment, and that's just to ensure that you have everybody on your plan, not just the ones that need it. Employee plans can be set up based on classifications or divisions, and employees can be added to that division as long as they meet the same criteria. So that could be a full-time class, a part-time class. You could have union and non-union. You could have owners, managers. You could even break it down by years of service if you wanted to. It is up to the employer to determine the classifications and make sure that the employees are put in the appropriate class. There is a little bit of effort there if you're setting up multiple classes, but it certainly does allow for some flexibility and also from a cost perspective. So part-time employees might not get the same amount of benefits as the full-time employees, and that would be a purpose for setting up a classification. And most plans require that employees work a minimum of 20 hours per week. That's sort of the industry standard. In Saskatchewan, labor standards does require that if you have more than 10 part-time equivalent employees and you're offering benefits to your full-time employees, you do need to add them to the plan as well. And the minimum number of hours, if you fall into that category, is actually 15 hours per week. But again, you would be able to set up a part-time employee class, and then you only have to offer them 50% of the benefits. So there are rules around that, but as a general guideline for small employers, 20 hours a week is sort of industry standard. So what does an advisor do? So what would I do in my role in the helping of creating an employee benefit plan? I would create, price, and help implement the employee plan and any group retirement savings plans. Those are two pieces. They can go hand in hand. You can do one or the other separately. I provide training sessions to employees, so that's where I would come out and we would sit down with your employees and go over your benefit plan. It can be specific issues. We could talk about heart health. We could talk about back health, back maintenance, non-smoking programming, whatever you want to do, but employee training sessions as it relates to health and wellness. I assist with claims issues, so that can be disability, medical leave situations. Again, just speaking there where we were talking about eligibility for somebody who was on disability, that would be an area where I would help. And if you're interested in developing any wellness programming, I would be able to assist with that as well. So negotiate renewal. So every year when that renewal comes along, I take a look at the information and negotiate on behalf with the insurance carrier to make sure you're priced appropriately. I can market any existing plan. So if you already have a benefit plan and you want somebody to take a look at it, I can come in and market that existing plan and ensure that your price sustainability is in line with your plan and your goals. And then I can provide some admin training. So all the large carriers nowadays have great online access. You can go in, add, terminate members. I can help with tips and tricks of the trade and how to simplify your plan for you, leverage some technology if that's appropriate. So it can help with all those aspects. And then one other key factor of when talking about advisors, it's always important to select your advisor first when you're looking at an employee benefit plan. So certainly if you have an advisor and you want to look at making changes, decide who you'd like to interview. Interview a few, see who's the best fit for your organization, and then let them run with the marketing. It's always best to have an advisor do the marketing for you, and preferably the advisor you're going to choose to work with in long term. And that's just because insurance carriers won't compete against themselves. So if you submitted a quote to an insurance company and it came from a couple different advisors, they're not going to release that quote to more than one advisor. And so that's why really it's always best to let your advisor do the marketing work for you, because there's not a lot of value add in working with multiple advisors all at once. So I'll talk a little bit quickly here about the coverages that are on a plan, and I'm just going to go through these fairly quickly. If you have any questions specifically, just let me know. But basic life insurance is kind of the main part of the employee benefit plan. It's mandatory on most plans. And it pays a lump sum benefit to the named beneficiary upon the member's death. It can be a percentage of salary, or it can be a flat amount, like a flat 25 or a flat $50,000, or 1 times, 2 times, 3 times salary. AD&D, which is accidental death and dismemberment, typically doubles the death benefit in the event of an accidental death. So if you had a 2 times annual death benefit, you would get 4 times your salary should you die as a result of an accident. And it also pays a percentage of the benefit amount for loss of use or loss of limbs, and that's where the dismemberment piece comes in. Death benefits can be non-taxable, and so that's you can when you have that amount, your beneficiaries receive that tax-free, and so that's an important aspect as well to keep in mind when you're determining the amount of insurance to purchase on your plan. Critical illness pays a lump sum to members up. And it pays to the member directly because it's a living benefit, and it's following the approval of a claim. It's paid in a lump sum. The funds can be used for anything, the member's discretion on what they want to do with that money. Again, it's non-taxable, so that's a key component. Most carriers, it varies by carrier on how many diseases are listed in the coverage. Usually 20 to 30 illnesses are listed. And so if you are diagnosed with one of the critical illnesses, there is an adjudication process done. And after the approval of that, then that's when the payment is received. For disability benefits, so again, I touched on it briefly, but I do feel that disability benefits are one of the most important coverages on an employee benefit program. So when we're talking disability benefits, we're thinking long-term and short-term, and they are most commonly available for groups of 2 or more employees on a group benefit plan without answering medical questions. If you are a sole proprietor, you absolutely have the opportunity to purchase disability insurance, and I do recommend that you investigate that. On an employee benefit program, you do need the 2, but you can definitely get an individual product if you're just looking for one person. So disability programs provide monthly income based on your pre-disability salary. And so if you think about, there's a little chart there, and if you think about how much money you earn over the course of your life, and put that forward 60 to 65 to age 65, you're really ensuring a large amount of income during that time. And the risk of disability is quite great. So you can see in the chart there the average age of disability and then how long the typical disability lasts for. So you can see that there is definite risk and it's valuable in having that coverage. Short-term disability typically pays on a weekly basis, so it's really designed to be a short-term claim that would cover you from anywhere from first day up to typically about 15 to 17 weeks. Long-term disability typically starts around that 15 to 17 week time frame. You don't have to insure short-term disability to get access to long-term. You can buy them individually. Long-term disability typically goes till age 65, and so that one is the key coverage there, just because if you were to go off on a claim when you were 40, for example, and it was a long-term claim, you potentially could receive disability payments for 25 years. Benefits are a percentage of salary, so that's always predefined when you're talking about the benefit plan design. Benefits are taxable if the member, or I guess we'll go the non-taxable. Benefits are non-taxable if the member pays 100% of the premiums. So if the employer pays even $1 towards the disability premiums, that makes the benefit taxable. And it's really up to the employer on the structure they want to have. A non-taxable plan means that you can have a reduced percentage of income replaced, because when you're not paying income tax, that kind of creates a bit of a buffer there to make the percentage less. If you have a taxable plan, you're going to want to keep in mind that the employees are still going to have to remit income tax, and they'll receive their benefit payable as a T4 statement, so that they are going to have to pay income tax on that. And in that reason, if you're looking at that, you'd want to set that percentage of salary slightly higher, just to accommodate so that the burden isn't too great, and there is funds available to pay the income tax on that product. So I have a question in here. Can a estranged marital partner not divorced, just separated, be considered as a beneficiary? Absolutely. So the beneficiary can be entirely decided by the member. And so you can name anybody you want. So if you wanted to name me, for example, you absolutely could. There, you would just want to ensure that you have a will, and that your will outlines those as well, just in case there's any chance that might be contested by somebody else. But certainly the beneficiary designation is entirely up to you. So that's a great question. So health and dental, switch over to that. This is always the sort of the area that gets the most attention and what people enjoy the most on the benefit plan, because it's where they see the value on an ongoing basis. Hopefully nobody needs to see the value of the life and the disability product, but members typically are making claims and seeing some of the value of their plan come in on that health and dental. So health coverage has two aspects. There's a true insurance component to it, and that would help to pay the unpredictable expenses, the things that could be catastrophic. And so those would include things like an out-of-country travel claim. So if you were in Mexico and had an appendicitis, for example, and your bill was, $50,000, that would be a coverage that would be under your plan that really is catastrophic loss. Most people don't have $50,000 just sitting around that they could pay that claim for. So that would be sort of the true insurance component to a health plan. Prescription drugs also can be in that category. We have drugs hitting the market all the time nowadays that are very expensive. So some drugs on the market can cost $100,000 a year. And so again, a lot of prescription drugs can be considered that true insurance as well. And then accidental dental coverage can be another one. If you have a kid on a skateboard and he knocks out all his front teeth, that could be well over $5,000 as well. So we're talking about large claims when we're talking about the true insurance aspect. And then there's the support aspect that just helps to pay for the predictable expenses. So those are more like the budgetary items. So basic dental, going in for your cleanings and your checkups, vision care, getting your eyes examined, buying glasses. And any of the paramedicals, so going for a massage or chiro. The idea of the group benefit plan is that it brings together all those aspects to help pay for them. But it's again not intended to pay absolutely everything or full amounts. One question I often get is, why can't we get more vision care coverage? And that's a good question. Vision care, that's the actual glasses, contacts, the hardware component, usually covers between $200 $250, maybe up to $300 on some plans. The reason that that doesn't actually cover the full amount of vision care is because when people purchase glasses, they typically use their benefit, and it can be very expensive for your plan. And we know that on the plan, there's going to be some people that purchase glasses and some people that don't need them. And so we don't want to pay 100% for the vision care cost. It would make the plan become too expensive. And so the idea is that the plan brings a little bit of value to everybody. And so you're going to assist employees in purchasing the glasses and getting that coverage. But you don't want to make the plan so expensive that or that you have to take away coverage elsewhere so that there is no value in the plan for people who don't wear glasses. So it's kind of, it's a very general example there, but kind of gives an idea of how plans are designed and how there is maximums put in on a lot of those coverages, just to ensure that the plan is sustainable and doesn't get too expensive for everyone. So we'll switch gears a little bit here and talk a little bit about why offering benefit programs makes sense. So benefits are good for business. There's all types of studies that speak to exactly how benefits improve. I've given a little chart there. It's actually an American chart, but I still find that the data on it is very interesting to get a sense of, just the impacts that you can see. And just going down the bullet points on the side here, there is an increase in the appeal for prospective clients or employees when you're looking at an employee benefit plan. There are studies that have shown that employees don't actually they won't apply for jobs if benefits aren't involved and in the initial offer. And millennials, even though when they're actually surveyed to see their usage of plans, their usage is actually fairly low. But many millennials believe that employee benefits should be just part of the employee benefit or the employee package. And so there's an expectation that benefits just come with jobs in the younger demographic. So it's interesting to see how that's changing a little bit. But employee benefits do improve the retention of current talent. When employees have satisfaction in their benefit program, they're feeling like there's a good value, there's things that they really like about their plan, they are more likely to stay with you. It improves the morale in the corporate culture. Just in having a benefit program, it definitely speaks to the employer's interest in the employee's well-being and their health. So that goes a long way. Healthy employees are more productive. There's all sorts of studies coming out right now. Every day you can probably read a new study around employee productivity. And they take fewer sick days. So if you do have that short-term disability program, there is a lot of savings available as well when you have a well-used and an intentional employee benefit program, that you'll see more productivity and people at work more often. And then better job performance. So presenteeism can be a challenge. It's something that was a buzzword a few years ago. We don't hear it quite as much now, but presenteeism is when an employee is sitting at their desk. They are actively at work, but they're distracted by other things. So they're there, but they're not actually present in their job. And again, an employee benefit program that takes away some of the risks for employees, that helps them stay healthy and strong, also helps them be more engaged when they're at work. So it alleviates some of the distractions that can come in. So employee assistance programs, so EAP or EFAP programming, can be a really great way to help reduce some of the presenteeism issues as well. So benefits are definitely good for business. So talk briefly here about benefits for sole proprietors. So even if you are just a one-man band, you can still have benefit programming. It can be designed ideally what best is suited to you. So we're going to talk a little bit about private health services plans, or PHSPs as they're called. You may have also heard them as healthcare spending account, which is an HSA. So those terms are slightly different, but for the purpose of this sort of introduction to benefits, we're going to use them somewhat interchangeably. So essentially, what a PHSP is a way to save tax dollars on your medical costs. So Canada Revenue Agency has approved a plan that allows the medical expenses of employees to become a deductible business expense for the employer. So this is ideal for sole proprietors because you may not have employees, it may just be you, but even if you're the only one, you can put through your medical and dental expenses as a business expense through your company. So this provides cost predictive, affordable, and flexible medical and dental coverage for your business. So in this model, typically what you do is you set up a flat dollar amount for your employees. So you can do it for yourself too if you're a sole proprietor. So essentially, if you want to set $2,000, just as an example. So I'm a sole proprietor, and I'm going to set myself $2,000 as the amount of what I predict is going to be my health and dental expenses. And every employee, instead of buying a formal employee benefit program, you may want to give each employee maybe $1,000 for the year. It's predictable in the fact that you know exactly what your health and dental costs are going to be for the year. It's not going to be based on just a rate, and then it's not subject to the annual renewals where your rates could go up and down. So there's a lot of benefit in knowing exactly what your plan is going to cost you. Now you have to keep in mind that this does not include the true insurance aspect. So it doesn't provide the out-of-country coverage, or if somebody were to be prescribed an expensive medication, that wouldn't be the same type of insurance on this plan. This is very much more just a pot of money that you set aside that is entirely a business expense for you, so you can write that off against your revenues, and then it's a tax-free benefit to your employees. So incorporated businesses have access to no true limits when you're incorporated, but you would want to run that past your accountant. Of course, you need to be ensuring that your business expenses are appropriate for your company. So you want to walk through that, but CRA does not set any hard and fast limits on incorporated companies. Unincorporated, so sole proprietors, partnerships, those companies are subject to regulations, and those are listed in the Income Tax Act. Typically, unincorporated businesses can spend $1,500 per employee on an HSA or a PHSP. So to explain it a little bit better, because the concept is always a little bit challenging, I made a little chart here on exactly how the process works. So the little office building with the trees, that would be the company. So the company sets aside the dollar amount for health and dental. And again, you can use the same classifications. So you can have owners, you can have full-time, you can have part-time employees, however you want to slice and dice it. Then you set aside the money per person. So if we just assume that it's a sole proprietor, so we can just use me as an example. So the company there with the trees there is Core Benefits. And then I'm the little employee down at the bottom. The bigger entity over on the right-hand side there is the insurance carrier. So you always need a third party, an independent third party, to adjudicate the claim. That ensures that the criteria for what an eligible medical expense is being met. And that is a requirement of an HSA or a PHSP. So you can't just adjudicate this on your own. You do need to have that third party in place. So Core Benefits sets aside $1,000 for me to spend throughout the year. So me as the employee, I incur claims and I pay for them up front. So I go to the dentist and the bill's $100 and I pay my dentist $100. Then that blue arrow going up to the insurance carrier shows me submitting the claims to the insurance carrier. The insurance carrier then reimburses me my $100, and Core Benefits pays the insurance carrier that $100 plus the admin fee, which is usually around 10%. So essentially, Core Benefits in the top green arrow would be sending $110 across to the insurance carrier, and the insurance carrier in turn is giving me back my $100. So in that transaction, Core Benefits has incurred a $110 expense. That's a complete business expense for them. The insurance carrier has retained a 10% fee for providing the service. And me as the employee, I went to the dentist and I had it fully covered. I was fully reimbursed, and there's no tax implications for me having that. There would be reporting sent back from the insurance carrier back to the core benefits entity, just to show exactly how much was claimed. There's privacy legislation that protects it, so they never get to see what type of claim, but they do get to see the dollar amounts, so they'll know that the amount used, and so they'll be able to track that. So it really is a great tax effective way to go. I really encourage small businesses, if you want to have an insured benefit program that does provide things like out of country and that drug coverage, you can always use this as an add-on. It's a great way to expense some of the claims. Things like orthodontic coverage that can be challenging for small groups to get on their plan. This is a really great way for you to use some of the revenues generated from your company to just pay for those expenses as they arise, rather than paying an ongoing monthly premium year over year, month over month for a claim that you may only submit every once in a while. And so that really, when you work with your advisor and you start creating your employee benefit program, you'll want to review all the different aspects and all the different products that you're able to put on your plan, so that you're able to make the best decision for your plan and for your tax perspective. So now we'll switch over to trends in the industry. So this is an area where I always enjoy going through this. I've been in the industry for about 20 years now, and things have come a long way. So one of the biggest areas, and an area that as an advisor I spend a lot of time focusing with my clients, is around holistic health and wellness. So holistic healthcare, again, is kind of a 2019 buzzword. It's a form of healing that considers the whole person, so body, mind, and spirit, in a quest for optimal health and wellness. It's a very fancy little definition there. But as you can see from the illustration, it really is figuring out how to maintain holistic health through every aspect. And the one area that isn't really outlined here, but is another big aspect of a holistic health, is a financial wellness perspective as well. So physical health, that's, the physical well-being. The emotional well-being comes from, we know a lot about mental health and the impacts there. And I do feel that financial well-being can fall under that emotional, and financial well-being is addressed through employee benefit programming. We haven't spent a lot of time talking about retirement programs, so group RSPs and pensions, but that plays a role in there, as well as the true insurance aspect. So life insurance, giving employees the ability to know that their families would be taken care of should something happen to them. The disability coverage, in knowing that if they were unable to work, that there would still be money coming in to help them pay their bills and keep their families going. And then the critical illness as well, which can be hugely beneficial when somebody is diagnosed with a very serious illness, that it can also provide that financial stability. So I'd like to cut out a little piece of that pie of the emotional well-being to fit in that financial piece. And then spiritual wellness as well. So that's taking into account whatever spirituality the member may be, but to bring that in full circle on the holistic health. So benefit plans are expanding their coverage to shift the focus a little bit more into this holistic perspective, to help employees treat symptoms with things other than simply medication. So that's where we bring in some of the EAP programming, some of the wellness programming. As an example, I had an employee who had been diagnosed with type 2 diabetes, and they took a holistic approach to their diabetic diagnosis. And so they used a variety of the aspects on their benefit plans. They saw a dietitian, they engaged in a wellness program that was at work that allowed them some access to fitness programming. They started some weight loss programming, and they were able to delay treatment of their diabetes with medication. And so to this day, they still don't require medication because they are looking at the the diagnosis as a whole. So instead of just receiving a diagnosis and a prescription at the same time, they took a different approach to it. And employee benefit plans really are shifting in that way. So that's been great for the industry. It's been great for employees, and we're going to see a lot more of this coming forward in the coming years for sure. And with that comes the data that is indicating that this concept actually does save money. So it saves money to the employee benefit plans. In that last example, we don't have any drug claims coming in for that particular individual because they aren't using the traditional medication to treat the plan. They are working on a holistic approach. So instead of just taking a prescription and running with it, they're looking at other avenues. And as we age, we are definitely an aging demographic. At age 45, the risk for chronic illness doubles. So typically that, and the chronic illness, these are categories where the holistic health approach can really make a difference. So another big area is around heart health, cholesterol management, and all those aspects. And so again, looking at it from the big picture, it does save money to have a plan that looks at all aspects of the healthcare program. The next big trend is virtual healthcare. So I suspect that everybody's probably heard a little bit about this. And some insurance companies are on the bandwagon, and they're promoting this. We have I've used Lumica as an example here. Lumica is a virtual healthcare provider here in Regina that has just been set up. So it gives you the abilities. It's a fee-based service offering people and businesses on-demand mobile access to Canadian nurses, psychologists, and doctors. And they are expanding to include other health and wellness professionals as well through a secure service. So you're able to see your healthcare professional just using your desktop, your laptop, your phone, whatever you have. And so this is a somewhat revolutionary in terms of employee benefit programming. And some carriers are starting to embed it into their benefit plans. If you're interested in working with Lumica, for example, here in Regina, we can embed that into your employee benefit program. And so there's a variety of different ways you can look at doing that, but it allows your employees and their dependents to see that physician right over your phone. So it is ideal when you need to renew a prescription, or if you have a minor ailment, you have a kid who has a rash, instead of taking time off work, picking your kid up from school, whatever the scenario is, you can just dial in and have that consultation right over your phone from the comfort of wherever you may be. You can also, if you need to refill your prescription, you can use one of the pharmacies that offer delivery service, and you can do it all right from your desk if you're inclined. So the virtual healthcare is really taking off in the United States. So we always look at the States as being kind of our best predictor of growth here in Canada as well. And so there has been a 75% increase in virtual healthcare being added to benefit programs. It also can be great because you can use it anywhere. So it can also replace some out-of-country coverage and some of the out-of-country claims that your plan can see. Just because if somebody, if it was in a medical emergency, of course, they would go to a doctor. But, if they get a bite on their leg, like an insect bite, and they just want somebody to take a look at it, instead of going to a clinic and having, a doctor from another country, look at it and then submit the claim back, you can just use the Lumica app and see a physician right then and there. So it is ideal. Right now, if you were to add it to an employee benefit program as a standalone, the premiums for the product are a taxable benefit. So that is something you'll want to keep in mind. But employees can also pay the premiums for the product, and we can add that in as well. So there's a lot of different options there. And so we expect to see big things from this over the next year. And it looks like we've got another question here. The workforce is aging. I want to bring in an older people age 60 plus. Is there any suggestion for dealing with older people to receive coverage? So that's a great question. So you want to take a look at your employee benefit program, and you're going to want to see what your policy specifics are around that. Some programs terminate at age 65, but it doesn't have to be. If you own your own benefit program, then you should be able to customize that. It may mean marketing and looking at some other providers, but you would be able to have that opportunity to increase coverage. Coverage can go to age 75. Some insurance carriers also just let it go to retirement. So employees are able to have the coverage for a longer period of time. Some plans also put a restriction so that employees hired after the age of 65 aren't included on the plan. But again, you would want to work with your advisor and find a carrier that would be willing to help you with that, because certainly the whole intent of employee benefit programs is that it is in covering everyone. The one coverage that would change is disability. Long-term disability typically terminates at age 65, and that's an industry standard right now that we have, and that's because CPP will pick employees up at age 65 for disability purposes. So insuring somebody over the age of 65 for disability becomes quite expensive. It can be cost prohibitive for some small carriers or small employers as well. So typically the long-term disability does terminate, but you would be able to offer them life insurance, short-term health and dental for sure over 65. That's a great question, and it is important to make sure that your benefit plan is bringing value to everyone. So you'll want to look at that as well. So the last slide that we have to talk about today is the legalization of cannabis. So, and when I say the legalization of cannabis, I'm speaking to the legalization of recreational cannabis. So the regulations for medicinal cannabis were not impacted at all by the legalization. But what it did do was that it put cannabis back on sort of mainstream. Everybody was talking about it, and employers have really stopped and paused to review their policy wording for the entire kind of concept around cannabis. From a medicinal cannabis perspective, nothing has changed. So again, you must obtain federal approval through the Access for Cannabis for Medical Purposes regulations. So that's ACMPR. That's been in place for many, many years. And in order to access medicinal, you do need to go through that process. And then so it must meet the medicinal purposes. So you must have one of the conditions that medicinal cannabis has been listed as being a treatment for. And so once you have that medicinal license, essentially, then you have to use one of the medicinal distributors in order to access that. You can add medicinal cannabis to your employee benefit program. So no carriers right now are just automatically including them. And it's a manual process. It's a manual process from a claim submission as well, because in order for, even though medicinal cannabis is a drug, it doesn't get covered under the prescription drug coverage, because in order for claims to go through on that prescription, it needs to have a DIN number, so a drug identification number, and cannabis does not have that. It doesn't sound like there's going to be any DIN number associated with cannabis anytime soon. So what that means is that anybody who wants to submit a claim would get the medicinal license, then they would fill it through an appropriate medicinal channel, and then they would be able to submit that to the benefit plan if your benefit plan covers that. And so it is a manual submission. You can also, if you did have a PHSP or an HSA account, that would be covered. So that is covered under that guideline. Again, as long as you have the approval. So one thing to consider is the cost aspect of medicinal cannabis and how you want to add that to your benefit plan. I certainly recommend to any company looking at adding it, put a maximum on it to see how the usage affects your plan. So if you just want to get a sense of what cannabis might cost, 1 gram of dried cannabis per day could cost your company about $1,000, $3,000 in claims annually. So 1 gram per day is about $8 to $9 per person that would be taking that. And of course, it varies depending on the strain and depending on where the product is purchased. But that can be a big expense to a small employee benefit program. So that's one area that we do want to move some caution towards. But certainly, if it's an area that you're interested in, it's definitely worth a conversation. Medical cannabis has been proven to keep employees at work, to keep employees healthy. There's a lot of benefits to it in terms of, especially, around when you're in palliative situations, it can be a great benefit to have. You just want to make sure that it's put in a very conscientious and cautious way. Okay, we have one more question here. Have you any experience with EAP, Employee Assistance Plans for Families with Addicted Youth Care? Any recommendations of companies that should be contacted? Yes, so EAPs, so Employee Assistance Programs, some people know it as EFAP, Employee Family Assistance Programming. Definitely. So that is a product. Some are embedded in the healthcare program. So depending on who your insurance carrier is, some plans automatically come with an EFAP. Other carriers have it as a standalone product that you can purchase. So definitely. And so what that does is there's sort of three main components to an EFAP program. The main piece is the counseling. So you can get face-to-face counseling. You can get counseling done by over the phone. There's some internet counseling available. There's group chats, that sort of thing. So the counseling aspect is the main component, and that definitely would take into account addictions. So whether that's a member or a dependent, an adult or a child, the counseling aspect would be covered off in the face-to-face counseling piece. And so there are a variety of companies doing good things around that right now. Sort of the main two that we see, Morneau Chappelle is one that they have a huge flexibility in what they can offer and how they offer it. And they work with employers of all different sizes. So that's a great one. Homewood Health is also another carrier. I'm not sure exactly where you are in the city, but Catholic Family Services, if you're in Regina, they have a really great program as well. So we certainly can get into a little bit more specifics after if you want to reach out. We can talk exactly about what you're kind of looking for there, but that's sort of where I would start. In the first place, if you have an employee benefit program, take a look and see if you've already got some coverage in there. But otherwise, certainly adding it to your benefit plan. So that's the counseling aspect. The other two pieces of the EAP that come with the programming are, again, around there's finance and legal aspects. So you can speak to a legal, and you just phone the toll-free number. It's all done over the phone for the legal and the financial. They won't actually review any hard documents, so you can't take your separation agreement and ask them to review it. But if you have questions around general law or financial questions, you would be able to ask them. So for example, if you had a financial question, should you lease or buy a car, you could phone the financial area and run through your scenario with them, and they can help give you some ideas on where to go. And so that really helps. That again helps with the presenteeism for employees, that if this is distracting them from their workday, they can make a quick call, have an intelligent conversation with a specialist at no cost to them, and then they can move on with their workday. There also can be help with childcare, elder care, some of those aspects that can affect people as well. So the EAP programs are hugely beneficial. So in Saskatchewan, the first name was Morneau Chappelle. Sorry, Morneau Chappelle is an EAP provider. They have great service, and depending on what insurance carrier you're using, some can just embed it, so you just get the one billing statement and your EAP is just included in there. They are also a great resource if you have any crisis counseling situations. So if you have a traumatic event happen in your workplace and you want to bring somebody in, they're fantastic for that as well. So they can just bring in counselors, have them on the ground, And even if you don't have a full EAP program, they have services for that sort of need as well. So there's been some great questions. I thank you for that. So that does conclude the end of the presentation. If there's any other questions, I think we can probably give a couple more minutes there, but otherwise I will transfer it back to you guys.
Perfect. I would like to give a huge thank you to Jenny for sharing some great information with us today. I also want to say thank you to everyone that was able to join us on today's webinar. You'll be able to view this webinar on demand on our website within the next few days. I just want to quickly remind everyone of our upcoming webinar taking place on June 19th with Rachel Hack and Yura from Miller Thompson as they share what is insolvency and how it can affect your business. Registration is on our website, so you can visit west.ca for more details. Thanks again, everyone, and have a great day.
Thank you.